Welcome to the last session of this final Radon meeting. There's certainly not least. Well, as in the other sessions, we will have first presenters and then a panel discussion. What is maybe a bit different is that this first presentation is going to be for one a long one, but very interesting one. You say the others are not interesting because it's going to be long. I guess all of you know Tanja, but I will introduce her anyway. So Tanja Perko works as a social scientist at the Belgian Nuclear Research Center, and as you all know, she was also the Work Package 6 leader within Radon. Besides being connected to SCK CEN, she is also connected to the University of Ljubljana in Slovenia and to the University of Antwerp in Belgium. So Tanja, the floor is
Thank you.
yours.
Can you, 10 minutes before the end, give me a note? So now everybody pick up your phone and take this quote down. So this is the first demonstration. What does it mean, demonstration? It's test. There may be mistakes. Okay? Okay, so I will present European Radon Behavioural Atlas and what we can learn from it in order to improve the radon action plans in the countries. But I would like to recall your memory on our first meeting, where I said that in our work package, we will improve the methods for sociological studies in the field of radon. We will improve communication tools, and we will improve the recommendations for authorities that they can that we will help them with implementation of radon action plans. So this is now what I will present now is bringing all the things together and to demonstrate you a bit of everything what we did. But a lot of things were done, but they are really useful for the authorities to implement their radon action plans, but also for the researchers that for instance, like I mentioned this morning, how to communicate uncertainties, that it's important and so on. So in this presentation, it's a huge team behind of the Work Package 6 members. Also, I would like to acknowledge European authorities responsible for implementation of radon action plans in the countries that they participated. We conducted many surveys. In the European Radon Behavior Atlas, we have 16 surveys with the data and everything. But in our toolbox that was coordinated by Marians, who is not able to be here, Marichel Martel from Spain. In this toolbox, we have the interviews, the protocols, the focus groups. We have the more surveys, for instance, the surveys where we tested how successful communication tools are and so on. In the methodological toolbox, look, there are a lot of things really transparently. Today, I put on the slides as the individual contribution of the early career researchers that they really help us to make this final push. Of course, Melissa Muric, a PhD student who will defend probably in September. She just gave in her PhD on the improved methodologies. So whole PhD on improved methodologies of social science research. So Melissa Muric, she was also co-responsible for data collection. Sophie Appers, she already defended her PhD on communication tools. So it's also publicly available, but also in the methodological toolbox and also in the STOR database. Then Aleika Zhumer, who helped me with visualization of the statistical data, and Neja Müller she developed this internet page that you are checking now, or I prefer that you are checking it later on. And yeah, of course, all Work Package 6 members. So the content now is that I will really show you that we are really doing this marvelous pioneering sociological research on radon and norm in the radon norm. It's really pioneering. So we did the first comprehensive sociological studies in the world focused on the radon norm. Nobody did it up till now so systematically, so thoroughly, with so many countries, with the same questionnaire, with the same method. We developed evidence-based and theory-driven strategic communication tools. We developed them based on the results from this sociological study. We tested what people need to know that they will change their behavior, that they will start testing and mitigating. we developed communication tools. We tested communication tools first in the small groups, and then we went in the field in Austria, Slovenia, and Belgium and Ireland. We tested these tools and we improved them, and now they are available in the store database for your use, for use of the all European member states in different languages. And then I will also present some recommendations that are important if you're going to implement either survey or either communication tools. So first, our survey. We conducted a survey in many countries, in many member states, but also in some particular regions. For instance, in Spain, we did it on the whole Spain, but also in Galicia. You know, Galicia is one of the most prone radon-prone areas in Spain. Or, for instance, in Belgium, we conducted it in Walloon region because Flanders region is not susceptible so much for radon as the Walloon region. So this is, on internet you will see that this is interactive atlas, which presents key findings from our public opinion survey about the views, about the attitudes, about the feelings and so on, related to the radon and norm. I will put much focus today on the radon, but there are also items that they measure the attitudes toward the norm, for instance. We ask people how do they perceive the norm material in the building, you know, or for recycling and so on, to support circular economy and so on. We conducted the surveys in these countries with the representative populations in all these regions, representative for gender, for age, for level of urbanization, so whether they live in the cities or live in the villages, the language, if it's in different countries, you have different languages and so on. But then, so now in European Radon Behavioural Atlas, we have only the studies that they have been conducted exactly with the same sampling method, with the same questionnaire and so on. But the same questionnaire we also applied with the citizen scientists this yellow, the light green countries. So the same questionnaire, and I must say that we have a great success with this questionnaire. The article has been accepted in Nature. It's on the, yes. Yes, but let's, I mean, I already saw the proofread, so. Yeah, okay, but this demonstration today and online, these citizen scientists are not included as a part of the because the sampling is different. They are completely, they are not representative. They are just citizen scientists who are more motivated. But there we have even more. Yeah. Okay. So because we wanted really to improve methodological stuff, this was the main key point for our radon activities in work package 6, but then we went on and we did much more. I would also like to pinpoint out that we were really attentive to the ethical compliance, to the legal compliance, and also privacy policy. So when you are going to implement your surveys and so on, you can just take these templates and you use them so that you will be also compliant with everything what we discussed at our ethical workshop last time. When we speak about people, whether they test and mitigate, and we are so disappointed that they don't do so much as we would like to, and so on, we always focus, the people need to be more aware about it. I mean, this is people's guilty or ours guilty that we are not communicating enough what radon is and so on. But it's not really so. You know, as sociologists, people from behavioral psychology in our group and so on, we know that there are much more things that they influence whether people test or mitigate. Something is, you know, psychological. So for me, my risk perception, my attitude, my expectations and so on. Something is on interpersonal level. For instance, whether do we trust to the one who's communicating us? Whether do we trust to the to the people on the street and so on, whether people on the street are mitigating or not. You know, we on the organizational level, you know, for instance, constructors, do they trust the constructors? Do they know where the constructors are? Do they know who is testing and so on? Are they available? You know, is it easy for them that they find them? You know, are they there? And then community level, you know, neighborhood, for instance, local communities, the resources that maybe some authorities are giving to support people to test and mitigate. And also societal levels, you know, also what is legal, what is required, and so on. And all this, so we didn't measure only knowledge of this person and risk perception of this person, but we measure what this person thinks, expects from all these levels. And this is how we can help with these results to the implementers of Radon Action Plans, because now we know what everything this person needs to do to test and mitigate, and what it helps. So we measured more than 27 social psychological aspects grounded in our different health protection and risk communication theories. And for each of them, for all these aspects, that they are really from the behavior models, we report in this European Radon Behavioural Atlas frequencies per country. We report also inter-country comparison. So you can see, for instance, level of knowledge in Czech Republic, level of knowledge in Czech Republic based on the exposure to the radon for different levels, you know, high exposure, middle exposure, low risk area, low radon risk area, middle risk area, and high risk area, but also among the countries, you know, so Czech Republic against, I don't know, Finland, you know. And then we report also scale attributes. I will speak about what this is, but like you, also I, as a social scientist, I cannot measure only one detector, what is your trust in something. I need to do many measurements. I need to measure in the different things, different aspects, so that I say, okay, this person is, as it trust is like this way, you know. So, and for this we also have validated and reliable scales. And we report these scale attributes. And then we also did correlations with this, all these items, these scales, with behavior, whether people test and mitigate. Because we can expect, for instance, yeah, people will know more about knowledge, about the radon, they will test more. It's not so. So there are other more important things. So with these correlations and the models, we identified for every country and in globally what are these things that we need to improve through communication that people will test and mitigate. Okay, so on the internet page, for instance, here are Germany. I open the site, you select the country, and for each country you get exact methodology. For instance, in Germany, we did what kind of interviews did we do, how long did it take, how many items they were, how did we do the pilot study, how was the soft start, and so on. So methodologically sound. If you are going to think about your own survey, follow these things, try to do it really, sampling, really important. You know, so all this is written there in really short, so methodological part, which is important. And I want to say that all data, all raw data, cleaned, so because we excluded some outliers, those people that they responded on the questionnaire that was 19 minutes long in 3 minutes, we took them out. And those that it took them too long, you know, we also took them out, for instance. Or we did, Melissa, she did a nice study on the acquiescence. So if people were just, I agree, you know, we took them out. So we have these codes that I ask you to, if you want to improve, clean your data, go to Melissa's work. But these cleaned data, they are in store database, and now they are now available for all scientific community and also for all countries. Anyway, countries you have anyway because the countries paid for this study, not Radon. They are available there to more in-depth studies. There on the internet page, you see there is also questionnaire, and all questionnaires, we translated them from English. The original was English. We translated them in German, and then other people translated from German back to English in order to avoid the different translations. This is according to the social science strategy. So this was done. And now all these questionnaires and questions, they are there in all these languages. So you don't need to translate anymore. You just select items which you want to apply and you use them in the language. So the questionnaire is there, but there is also technical report. And in this technical report, there are really important information, description of the panel, who was there, the field work, the method, the scripting procedure, the quality control, the data preparation, the weights, and all this there is in the technical report. There are also instructions when you will contract the company to do the surveys. There are instructions what you need to ask the company. And there are also the weights for the different things, quality, number of people, the reference, all this stuff. So you just apply these things, so you will be able to subcontract the company for the field work in much easier way. You will not anymore explore what you need to ask and what you need to evaluate, but now this is there. Then we have the results. So in the results we have for all these scales, you remember 27 scales and so on. We have for instance, this is from Germany. It's about the radon awareness and protection behavior. Are people in Germany aware of radon and do they test and mitigate, Then you click on these results and you get a bigger file, bigger results in frequencies. And you can read also then, when you make it bigger, you can also read, for instance, do you know what the question was? Do you know anything about radon? And then, yes, I have heard something about it, and no. And you see, for instance, for the radon risk areas, you see whether there is some difference. This is, for instance, the result from Germany. We see that not a lot of people, we got in our sample only 5 people from high radon, with the high radon concentration. And that all of them, they know what is radon and they have heard about it. And for the medium and low level is a bit different. Then, for instance, this is the example from Spain. We ask people, because the trust is complex issue. We cannot just say people trust us and we measure with one item. For instance, here we ask them, are they telling the truth? Different actors. Are they telling the truth about radon risks? And are they technically competent regard to the mitigation? In Spain, we see that the most trustworthy is CEMAT. Bravo, colleagues. And Nuclear Safety Council. Also, remediation experts are really trustworthy, but the problem is that only 8% of people know them. So the size of this bubble also explains how many people they know them, because there's no point to ask them whether they are telling the truth if they never heard about it. So the provincial council is the list in Spain, and this is in every country is different. They're specific. Public health authorities were also not trusted. I must say that this was done, I don't know, for Spain it was done like 2 years after the COVID. It was still the effect probably from their family doctors and so on. So you can see now for every country who is good communicator. In this way, no, I don't mean that the CMAT knows how to communicate, but definitely about the radon, if you want to persuade people that they test and mitigate, use CMAT, make connections with Nuclear Safety Council in this case. So we could then elaborate more on all of these results. Okay, then we have inter-country comparison. And that is a bigger part written on the methodology because it's really important, because we have, for instance, in Bulgaria, we had a bit different sampling. No, we had the same sampling method. It was also representative, but it was face-to-face interviews. In other countries, it was computer-assisted internet interviews. It was internet interview, but for sampling, for instance, in Czech Republic, it was a bit different. They were included the people that they were part of the huger survey intervention of the country, while in the other countries, they were really randomly selected according to quota from the panels. What you have in this inter-country comparison, there is also a full questionnaire with all languages. So the questions that they were applied in the countries, they are translated, and so you have the many colors. Each color is different country. You can use this. And in the beginning of this questionnaire, there are also instructions. What do you need to ask the company when you will decide to subcontract the company? So there are good instructions there. This is available in store database and on internet page. So some results from inter-country comparison, for instance, radon protection behavior. Behavior is something really that we do, that we really test it and really mitigate it. So we ask people, have you or has someone else ever tested your current residence for radon? And green means yes, orange means no, and gray means I don't know. So we can see, for instance, Czech Republic is the highest, but probably because of the different sampling, followed by Sweden, and then, all the other countries, Norway has also quite a lot, but then there are few. Please be attentive. For instance, you need to know how to interpret these things. In Slovenia, the survey has been done in the whole country, representative for whole country, not only on the radon-prone areas. So normally, the people that they live, I don't know, in which flat in the capital city, that they don't test it. So this doesn't say how successful authorities are, but it's just, to inform authorities where they can work and how on, and then they can also, they need to read exactly in the methodological section who are these people. But just to a bit, to compare. Or for instance, the level of agreement on the question, radon may be a problem, but I haven't paid much attention to it because there are more important things to deal with, And so the people that they strongly agree, they are green. It means those people that they have other concerns on their head more important than the radon. And orange are those that they are they disagree, and they strongly disagree with the things that radon is important. So, and here again you can see the different things. For instance, in Sweden we see that 28 people are neutral about this, and 16% of people they disagree with this statement. So radon is important for them, for instance. But you have all this on the internet, which you can then take time and you can look into these graphs more in details, because this is important that we maybe, with authorities, that maybe we sit together and we interpret these results together, because if you interpret them wrongly, you can do a big mistakes. For instance, radon knowledge across countries. We know that all countries, they were trying to, according to the new directive, Basic Safety Standard Directive, increase the awareness about the radon. And in our survey, we say awareness is that you know that radon exists, and knowledge is that you really have a school knowledge about it, that you know that this is radioactive gas, that it causes lung cancer, that you don't get a headache from the radon, because a lot of people think that they get headaches from the radon and so on, that you know that you need to measure it with the special tools, that you know some general information about the radioactivity, for instance, that the natural body is also, that the body is also naturally radioactive, and that with the time you consume, you accumulate the radiation and so on. So different items, we measure them from 11 to 13 items in every country. And then we calculated, percentages of correct answer per country. And we can see, for instance, in Spain, only 24%, in Portugal, 27%, Bulgaria, 24%, Germany, 37%. This is, what is this? What?
Czech Republic.
Czech Republic, sorry. It's 94%, but the winners here are definitely Scandinavian countries, But again, we need to be careful when we interpret these things, because inside of the country, there may be huge differences. For instance, Spain, we look in the whole Spain, but we look also in Galicia. People in Galicia, they know much more about the radon, than people in general in Spain, which makes sense. So it means probably there was some kind of targeted campaign, more intensified, that people know about the radon in these countries. Or for instance, what is really important is self-efficacy, that the residents have confidence in their own ability to conduct radon testing and mitigate effectively if needed, And for instance, here is a question which is really interesting from my point of view, also from the study that I presented before with this, what everything is. We ask people, I am confident I would be able to hire a contractor to decrease the indoor radon concentration if I wanted to. So to find the industry that will do it, and green is strongly agree and agree. What is the problematic is orange and this almost red. So we can see that, for instance, in Portugal, a lot of people, they will just not do it because they cannot find, then it's better not to know about results if you think that you cannot find somebody that can mitigate the house. Or for instance, in Spain, it's also a lot, or in Greece, And now if we connect this back to the Radon Action Plans, where the Radon Action Plans have been developed in these countries, and when they started to implement them and how intensified they do it, it makes sense, all together. So it's not only communication campaign, but it's all Radon Action Plan that we need to. And then, for instance, radon risk perception across countries, we can see that the highest risk perception, we ask people, it's really important how do you ask people, how do you perceive the potential risk to your health within the next 20 years from indoor air pollution due to radon and the presence of the naturally, or the presence of the naturally radioactive gas radon indoors? Because we had half of the population was asked indoor air pollution due to radon, and the other half was naturally radioactive gas. We found out that it has a different effect. How do you formulate it? But this is another presentation. So we see that in Wallonia, in Belgium, is the highest, and the lowest is in Sweden. And what does it say? This, risk perception. What is this? How do you? It's only one item, Can we interpret something from this? No, we have to be really careful about this, because what we found out, and we already know this from the sociological studies, that if you measure some latent construct, which is so complicated, risk perception, you need to measure it with more things, like your radon that you measure in different stuff. So when we measure it with a factor, conditional susceptibility with 3 items, we can explain, or with 1 item, we can explain radiation protection behavior, whether people will test and mitigate, follow the advice, much more. So when we use more items, we can explain human behavior much better. This is just a bit to demonstrate how important the tool survey is. If you will let it to apply it just on the gut feelings, or because or let it to apply to somebody who doesn't know about the human beings as social psychological beings, you will get wrong results. You will not do it well. So we need to have a scale. But good news is Radon developed these scales. We know which items we need to ask and how much these items they explain the human behavior. So you can go to per country to see which these latent constructs influence whether people in your country will test and mitigate. So this is, you go to download common statistical scale characteristics and correlations with behavioral intention here, and then you get, for all countries and for all together, you get the scale characteristics, which items were there, what do they explain, how much do they explain, and so on. So this is done. You don't need to develop it anymore. You don't need to hire people anymore to do this. You just look into your country, what is the most influential. You apply this, you take from the questionnaire exact translations, you hire the company which will respond the best on your questions, and you have these things. So now we have these scales, so important. So what you can find out with this scale. So we have one scale. On this side is the descriptive norms. This is the people we mitigate and test more if the environment that people street around us, that people that we know around us are doing. You know, this is one part, and the other part is intention to protect from radon, which are also 3 items or 4 items, it depends for which country. And what did we find out is, for instance, that those people that they have high descriptive, that they know that people on the street, people that they know, people that they are in their friend groups, that they tested and mitigated, those people will have also high intention to test and mitigate, you know. So it's really important that we communicate this, that people are testing and mitigating. You know, all your friends, all your streets is testing and mitigating. What about you? You know, so we need to communicate this, not radon is the radioactive gas that causes lung cancer, you know. So with this kind of analysis, which is also there now, you know what you need to, on which things you need to press that people will test and mitigate. Okay, we found out that this is really important, whether people will test and mitigate, people that you know will test and mitigate. So from this on, we said, okay, so now we have sociological study. Now we know what influences people's behavior. We know how to measure the things. We even have the cross-country comparisons. We have the questionnaire translated and everything is done. But what about now? How to communicate these things? How to, with communication, improve people's behavior? So what did we find out? What we can learn from this survey is that we need to tailor communication strategies to specific population groups. It's not okay if you do radon communication campaign in the whole Spain, do it on the high radon prone area. Do it with the decision makers in the family. Do it with the right channels. There are also channels, you know, which channels people use, communication channels people use and so on, and which group and so on. That we need to go beyond awareness to address, and we need to address emotions, perceptions, what people are doing and so on. That we need to share personal stories and successful mitigation examples, not threaten people, you know, but let's share successful mitigation, you know. We can say, Anna from this street successfully mitigated this house. What about you? Will you follow? So these kind of things. Then we need testimonials from individuals affected by lung cancer. This was the most effective latent construct. If people know somebody or have heard somebody that developed a lung cancer due to radon, they will definitely test and mitigate. So if you share this, you know, through the communication, and we need to promote positive social norms to inspire actions, not negative. And we did it. We developed communication tools according to the procedure that I mentioned before. So, for instance, this is one communication tool. This is for the web page. Web page is there in store database. It's in 3 languages, in French, Dutch, English, German, Slovene, 5 languages. It's there. You can freely download it, adapt it to your context, and use it. So we developed this Radon Buster stuff, and this is, for instance, on the addressing descriptive and social norms. For instance, on our code for the web page, is like, it's written that so many people already tested. So every time that somebody assign or order test or something, number goes up. So this is how you move the social movement, actually, how you got it. So gives an impression. We, for instance, developed classical newspaper article with a personal story. For instance, here, young and incurably ill, Natalie breaks the silence on lung cancer. It's not the lungs and interaction with the radon, but it's a real person, a mother of 3 children. You know, so you can adapt it. You can find cases, share these things. So this is also available in stored database, and you can use this template. Then we developed social media, really important, really influential. And this social media, it addresses dynamic norms, you know. And how did we explain what radon is? Was also carefully tested. For instance, you know, did you know? Radon, an invisible natural, you know, gas and so on. And this is also translated in many languages. You can go to store database and you can start your own social media campaign if you want, immediately. You know, use this material or adapt it, you know, go for it. We used also humor, huh? And because of humor, according to our studies, it also helps not so much to understand, but more to spread the news. People like to share the humoristic stuff on the social media. So this is also in store database in different languages. Just download it, use it, share it, whatever. There are these radon busters that you can use and adapt to your own context and modify it, but please use it. You're entitled to use it. There on the internet page and in the store database, you also have the guidelines how to implement communication in Radon Action Plans. There is a milestone where are also the prices. For instance, social media campaign costs, for instance, they cost in Slovenia, it costed us to achieve, I think, 20,000 people. It costed us 500 euros. The highest cost was 1,400 euros in Ireland, which was the most expensive. You have costs down there. You have how do you start with analysis? How do you define communication strategies? How do you launch a campaign? You also have the communication strategy lecture, how to develop it. You have a lecture on communication channels and how do you evaluate whether your internet page is good or not. The template there, you can download this and you can evaluate your own internet page. And how to implement a survey. It's also possible to find it on store database. There was a course. I would definitely invite you to go at least to this public opinion survey from Idea to Results, which tells you what kind of topics you need to think about before you go in the field work with the survey and who everything needs to be involved. So you need a social scientist, this category, you need methodologists, you need internet person, you need somebody with radiation expertise and so on. For every step is written how many people do you need and so on. Training course in the store database. Thank you, Paul. So to conclude, recommendations. Utilize this European Radon Behavioural Atlas as a modular questionnaire for flexibility. Take out the scales that they are important for you, that you see that they're important or maybe important in your country. It's really important that you ensure proper respondent sampling. Sampling is so important, like in the radon, you know, when you do the measurements. Also for social campaigns. It's not that you can just ask your colleagues and families of your colleagues to respond on the questionnaire, but sampling is the key. Otherwise, all data are for nothing. Then use multiple items, not only one. You remember risk perception. Use multiple items that you avoid unnecessary changes. Don't just change the words in the questions, because we adapted them, we checked them, we know why these words are there. We know why do we say indoor air pollutant and we don't say, I don't know, natural gas in the questions. Focus on concepts, assemble multidisciplinary team for comprehensive survey development and also analysis. Not only one person can do it, because there is no so smart person that can understand all the things from different aspects. Everything is in the store database, please use it. This is done by public money. The authorities on these countries, they paid themselves and gave us this data available. I'm paid by the public money from the European Commission. We need to make this available. Do it. I'm also aware that maybe some mistakes may be discovered, but I'm willing to, to do this, to inform the European community, but also to improve the scientific contribution. And please leave results to interpretation to qualified scientists for accurate insights. So European Atlas is there, use it. Communication tools are also there. They are theory-based, they are field-tested, they are also strategically refined, and they are available for all European member states. All data, lectures, supporting documents, including recommendations, everything is there on the internet page of Radon, but also on the store database. And I would so like to have another project now to implement these results really in the practice and coordinate the things that people will more test and more mitigate.
Thank you, Tanja.